Hello, I'm Jane Hill. In my day job, I'm a presenter with BBC News, but I've been asked to introduce this video because I have a history of Parkinson's in my family. I know from everything that my father and my uncle, Dad's brother, went through over very many years, that hospital admissions and procedures can be very stressful, both for the person with the condition and for the people who are looking after them. And delays in administering medication can make the patient's condition worse. This video has been put together by staff at Leeds Teaching Hospital NHS Trust to try to help educate all staff about the importance of getting the administration of medication right, both for the person with Parkinson's and their families.
Parkinson's disease is a neurological condition caused when dopamine-producing cells in a certain part of the brain stop working. Dopamine is a chemical in the brain which helps refine and coordinate movement. Over time, the levels of dopamine in the brain in people with Parkinson's disease reduces, and reduction in a level of dopamine in the brain is what causes the motor or movement symptoms of Parkinson's disease. The classic symptoms of Parkinson's disease are a resting tremor, stiffness or rigidity, and a slowness of movement known as bradykinesia. Over time, these symptoms can worsen and other symptoms can develop. These include problems with memory and thinking, problems with the bladder, potential for low mood, and difficulty swallowing. Parkinson's disease is usually a condition that begins when people are in their 60s, but there's a wide spectrum and it can affect both young people and very old people.
So medications in Parkinson's help to top up dopamine levels because in Parkinson's the level of dopamine is too low and they need to be taken regularly to do this. So one way to think about this is to imagine the brain as a bath and the level of water represents the level of dopamine in the brain. And because in Parkinson's the level of water is too low, the medications are like turning the tap on. They add more water to the bath. However, after each dose of medication or each time you've turned the tap on, the water does also drain out of the bath because there's enzymes in the brain breaking the dopamine down. So you need to repeatedly take the medications to keep topping up the level of water in the bath and keep movements as normal as possible. Many people with Parkinson's will develop a personalised treatment regimen with their consultant, which will involve taking medications for Parkinson's at regular intervals. And these medications are time critical. If medications are missed, there are increased risks of complications such as aspiration pneumonia and falls. And in the worst case scenario, if several doses of medications are missed, people with Parkinson's can become so off that their muscles become extremely rigid. Basically, the muscles begin to break down, and if there is a lot of muscle breakdown, the person with Parkinson's can develop renal failure, cardiac arrest, and can even die from this. So it's really important that medications for Parkinson's are given on time.
At Leeds Teaching Hospitals, the safety of our patients with Parkinson's disease is paramount, and we're keen to help improve patient care. Parkinson's disease is a disease of ageing, and so now many of our wards will have a patient with Parkinson's disease as one of their comorbidities. Although generally the care of our patients with Parkinson's disease is excellent, this has not always been the case for every patient.
So we set up a Parkinson's Quality Improvement Collaborative, which consisted of staff from all areas of the MDT with an interest in Parkinson's disease, as well as Jane, working together to improve the care of people with Parkinson's disease. We had two aims. We wanted to reduce the delays in medication administration for Parkinson's patients, and we also wanted to reduce the total number of dose omissions in order to provide safe and quality care. Our most successful interventions include
patient alerts. When a patient with Parkinson's disease has been admitted to the ward, we alert staff by using laminated posters and magnets above the patient's bedside. We want to empower all staff in the clinical area to check whether patients may need medications before they're taken off the ward. We're also using prompts on our e-meds prescribing system to alert nursing staff of any time-critical medications.
Clip-on alarm clocks. These small alarm clocks are worn by nurses and can be set to alarm when a medication is due. And they're particularly useful if a medication is due outside of the normal drug round times. Staff so far have found these extremely helpful.
Handover. Identifying any patients that have Parkinson's at handover, along with any instructions for medications and any clinical concerns that we may have.
Specialist input. People with Parkinson's can have complex symptoms, and this is particularly the case if they have an acute deterioration whilst they are in hospital. Sometimes they may be unable to swallow their medication, but it is still essential that they receive some form of Parkinson's medication. This may therefore need to be administered via a nasogastric or a PEG tube, or sometimes this can be administered via a patch or subcutaneously, but this requires specialist advice. In ours, we have a dedicated Parkinson's team who can advise, as well as speech and language therapists. Out of hours, call the neurology registrar or pharmacist on call. We have produced stickers as well as laminated posters summarising these contact details for medical teams. Don't be afraid to call.
Staff education. We've set up an education programme to help deliver more information about the complexities of managing patients with Parkinson's disease. We run a trust-wide masterclass which is held twice yearly. We also have a comprehensive trust guidelines on Parkinson's disease which can be found on the Trust intranet.
As a result of these simple interventions, the delay in administration of first dose of Parkinson's medication after admission has fallen from over 7 hours to 1 hour. The average percentage of Parkinson's disease medication omissions has fallen from 15% to just over 3%.
You've heard how much we've improved the care for our patients with Parkinson's disease, but there's still much to do. So we need your help to ensure that every patient with Parkinson's disease gets their medication on time. So please help us to do that.
Thank you for everything you do for people with Parkinson's, and I hope this film is useful.